On-the-scene video coverage of AHA 2012 is supported by Pradaxa.
This study shows a pretty predictable result that if you combine the meds, then we're more effective in controlling risk factors and get better adherence, and that's great. And that may be good in and of itself, but I'm really waiting to see what's going to happen with the outcomes studies because although they're promoting the safety of this approach now, when you get large numbers of patients and you look over longer periods of time, the question will be whether or not this is a strategy that is both effective and efficient.
I think it's very clear from this study, and I think others have shown it as well, that when we simplify regimens, number one, and when we actually give patients the medication, we hand it to them, we deliver it to their home, we can get compliance rates well into the 80s, even the 90s when we deliver it to their home. So we have the ability to assist people in taking medications. So I think that also then throws it back in our lap as a society, as governments. Do we have the willpower to do that? One of the things as healthcare providers we're always worried about is these fixed dose combinations. Are they lowering blood pressure too much? Are they causing other untoward effects in patients because they're not really being titrated by a healthcare provider, they're just being given?
I think the important thing, and it's probably not surprising, was that drug adherence was much better in those patients on the poly pill. Possibly because number one, it's simpler to take, or number two is that it was at no cost to those individuals, and certainly that can make a difference. Their cholesterols were lower, their blood pressures were lower. All these things are good, and their adherence is better. If you could do something that is far less expensive and you will increase compliance, then all of those down the road costs for strokes, for heart disease, are going to be reduced.